1340, 96.5 KVGC. Again, Dr. Rita Kerr and Jim McHargue are in the studio with us today. And great program that was launched. And we call it here at the studio because we were introduced to it as the Don't Rush the Flush program. So that's what we call it. But I'm assuming there's probably a more official name. Isn't there?
Well, Don't Rush to Flush is I think the campaign that this on a statewide level that has been introduced, but we call it drug collection bins. So these are like the mailboxes.
Come on,
steroids.
Jim, you got to have some kind of a sexy name for it, not drug collection bins.
That's right.
Don't rush to flush.
That's right. There was another one too.
Meds in the bin, we all win.
There you go.
That's the second. Yeah. That's sort of the subtitle to the.
Leave
Don't
it to
Rush
Dr. Kerr. She'll come up with that one. That's a good one. All right. So these are bins, and we've talked we've had a number of news stories on this. We talked with, I think it was Heidi, a week or two ago about this as well. There was an event on the 28th, which was National Drug Take Back Day at the Ione Police Department, where they kind of unveiled their bin. How they had it for a while, but they unveiled it. And it's a great idea because, I mean, the sheriff's office does the DEA Drug Take Back Day. Is it twice a year? I think it's
spring and fall.
Spring and fall. But, you know, there are other times when we have drugs around the house that need to be. And I was talking to Jim about this, Dr. Kerr, before you came in. You know, we have a number of pet medicines.
Yep.
Around that. I don't know what they are. I mean, I don't know if drug addicts would want them if they get the mange or fleas or, you know, a kennel cough or something. But we have can you drop those off?
Yes, you can drop human medications, pet medications, and over-the-counter medications. Really the only thing that they ask that you keep out of the bin are vitamin tablets, because if those get moist, they tend to get kind of malodorous.
Yeah, and we were joking. I was joking to Jim and Dr. Kerr about this, that, you know, we have a few expired drugs in our house, and I wait every other day and flush them down the toilet, so I'm not sending them all down at once. And this is what this whole program is. I mean, I would hope that there's nobody in today's society that flushes any drugs, because we've been on this for years now. Don't flush things down the toilet because it's going to get to the groundwater. It'll come back and get us sooner or later. But you said, Dr. Kerr, that you can flush vitamins? You can throw vitamins away?
You could put them in the garbage can or into... Again, you don't want to clog up your toilet pipes or septic system with those either. So again, not flushing is probably a good idea, but it's okay to put vitamins in the trash.
But do not put drugs in the garbage.
Do not.
We do not recommend throwing away your prescription or over-the-counter or veterinary medications. I mean, that's what this all comes down to, Jim. People can't see we're on radio, but these are the... Oh, okay. So these are some old expired medication that I happen to have, and this is what we're talking about. And so what happens when somebody's got to move all of a sudden, or maybe a family member passes away and you've got a bunch of meds? What do you do with them? You need an easy and convenient way to get rid of these things. That's what this really addresses. So we've put these new bins, one's at Ione Police Department, one's at Ione Pharmacy, and one's right here at Jackson PD. And we're really proud of these groups stepping up.
And are you looking for another site or two?
We've got one more bin.
That'd be great if we could have one in the upcountry.
It would.
If someone could step up.
All of the, it has to be in a retail pharmacy or a law enforcement agency.
And it doesn't cost anything for the host person to have this, right? You just install it for them?
We have gotten support from our great community partners, including the Amador Child Prevention Council through First Five. The Hospital Community Foundation has stepped up. Supervisor Lynn Morgan has stepped up, and several other community groups have stepped up to provide the seed money so that we can pay for the disposal costs. These things get shipped back securely to a reverse distributor where they're incinerated, and that's the way they get disposed of.
Now, Dr. Kerr, I noticed that, Jim, you took the label off of your prescription bottle. Are you required to do that? before
We
you drop it off?
recommend, but really what I would probably do, Jim, with this is I would dump these out of the bottle and just have them in the plastic
In a
baggie,
plastic bag.
and then take them and deposit them in the bins that we've placed at Ione PD, Ione Pharmacy in
And then
Jackson.
can you throw the plastic pill bottle away if you want? That can be tossed or
That can be
Can
tossed
that be
or
recycled, Jim?
Scratch off any identifying information. That's why I tore the label off of this one, because you just don't want your personal information out there.
Right.
So that's the recommendation.
Yeah.
We don't want these in the garbage. We don't want them going down the toilet. And the problems are, as you and I were talking, theft. People get a hold of these. Kids, teenagers can get a hold of them.
Yeah.
We don't want them going into the environment. The water treatment systems aren't equipped to deal with these medications, so they're a real problem.
That was during when you and Heidi went before, when your group went before the Board of Supervisors. There was a figure that you used, and I think it was eternity. If you put a drug in the water or in the groundwater, it doesn't ever go away. It's always there to some degree.
Well, a lot of these are synthetic chemical compounds that don't break down. They don't. Our filtration systems, our biodegradation in the landfills is not really designed to mitigate these compounds. And so they stay in their chemical state, active chemical state, for decades at a minimum.
So does that brings up another point. I see there's a bottle of pills here, and it has an expiration date on it or whatever. Is that really an expiration date then?
The potency of the medication is guaranteed through that date.
Okay.
There are some compounds. I don't know if you've ever opened up an old bottle of aspirin and took a whiff.
Yeah.
It smells like vinegar.
Yeah.
So that particular chemical compound degrades somewhat into that component.
So if it smells that way, the aspirins aren't
They're not good
anymore?
anymore.
Wow. Okay. That's a little household tip, and that's not a wives' tale. That's a real
No, that's a real
household
chemical
tip.
reaction.
Yeah. Wow. I didn't know that. Do you know that, Jim? Don't say you did. Because,
I did.
okay.
No, I just learned that today.
So by disposing these improperly, we could be hurting the environment for a long time to come.
Absolutely. And the if they get into the water system, the marine life,
Yeah.
the small organisms, small fish, frogs, tend to accumulate them because their body mass is so much smaller.
Dr. Kerr, let's talk some numbers here. Accidental drug overdoses, accidental poisonings, kids getting into drugs.
Yep. I'll give you a statistic that the Poison Control Centers nationwide publish, that 60,000 children a day visit an emergency room from an accidental pill ingestion. That's about 4 school bus loads. That 60,000 is a yearly number.
Okay.
4 school bus loads of kids per day.
Wow, go to an emergency room somewhere in
That's
the
the
nation.
little kids. Your pets can also get into them. The statistics about teenagers is that most teenagers get their pills that they are taking that they shouldn't be out of the family medicine cabinet or grandma's medicine cabinet or at a friend's house. 70% plus say they get them that way.
The opioid addiction, does that go across the demographic, age demographic?
Absolutely. It can be, there are just some people who have more tendency to get dependence on opioids, just like there's some people who have tendency to get dependence on alcohol. Not everyone who drinks becomes an alcoholic. Not everyone who has to take an opiate for pain becomes an opioid addict, but some do, and it crosses all age spans, races, and socioeconomic groups.
Dr. Kerr, do you think that opioids, because that's the buzzword of the day now, do you think that will eventually go away and we won't pay attention to it, or do you think that'll stay in the forefront for a long time to come?
It's a really challenging problem, so I think it's going to be in the forefront for quite a while. There are certainly a lot of bright people working on the issue to try and figure out ways to at least get it under some sense of control.
I was reading a figure the other day where, I don't think it was weekly, but monthly, so many million of people get taken out of the workforce because of opioids, and most of them are young males.
I haven't seen that
Yeah, and it
statistic,
was
but
like,
one thing I want to
whoa,
point out is
whoa.
that prescription medications are just as dangerous as street drugs. And a significant number of these opioid overdose deaths that we're hearing about nationwide are from misused prescription medications. It's not all street drugs.
So, Jim, if someone comes upon some illegal drug, can they, I don't know, find some cocaine or some heroin or whatever? Can they drop it in this bin, or should they call the police? Or
Well, if they come across some sort of illicit drug, I would recommend dropping it off at like the sheriff's office. But if they have some of these, prescription medications that they come across or they find, like, I was going to say, Jim, you had mentioned you got this shoebox of old medications at your house. We live in a different time now. So nowadays, people, like say you go on vacation, people are breaking into homes. They're going right to the bathroom, to the medicine cabinets.
Really?
To harvest these meds, So the risk is really there. Now, another problem that has been reported is, say you've got these meds stashed or put away at your house, but you have a party and you have a bunch of people coming in. A lot of these people that gain a dependency on these meds are going to the bathrooms to look into your cabinets. So it's something that we don't think about, but it's a different day and a different time these days.
And just
all
from
they
a
find is old toothbrushes and rolled up toothpaste and stuff like
Well,
that.
from a safety standpoint, really, medication should be stored in the home in a locked cabinet.
Yeah.
From the standpoint of keeping people who don't belong out of them, and the kids and the pets out of them as well.
I'm giving you that look.
Yeah.
Come on, in a locked cabinet? Who has
At
a locked?
least-
Who has a locked cabinet that they can store them in?
Well, now
we
we've
could-
got a place for them to go. So that's the key here.
No, but not my used ones. My
No, the ones
current
that
ones.
you're
That's
currently
I mean, it's a
taking.
great idea.
Right.
I'm not looking at you like, hey, that's a silly
could,
idea.
It could be as
I'm
simple
looking-
as putting, a simple
Wow.
combination or a padlock
Yeah.
on one drawer that you keep your medications stored in, and just from a safety standpoint, that's what's recommended.
So this is funny, but I'll share a story with you. We rented a home one time for a vacation, and there was locks, like a hasp for a lock on all the bathroom doors. And it was like, what is this all about? Locking people out of the bathroom doors. What it was the original homeowner had put those in there so he could lock them when he went out, because his son was a drug addict. He didn't want his son to be able to get into the bathrooms where they kept the drugs. So they actually locked with a master lock, locked the bathrooms up. So it's not that silly. I mean,
No.
it happens.
It
happens.
does,
We just don't
absolutely.
think, again, it's like any other bad thing, like child abuse or sexual abuse or whatever. We don't think it happens here in Little Amador County. But it does.
Yeah.
It does.
It does. I
We're
mean,
unfortunately not immune to the problems
Yeah,
of
yeah.
society at large.
So we're looking for one more spot to put a bin.
That's right.
Now, are these bins open 24 hours? Like, can I go to Ione Pharmacy? Is it outside, inside?
They are indoors, so
Okay,
they're going to
indoors.
be available when the facility is open.
And I can go to the Jackson Police here,
Jackson PD, you just bring them to the window and their bins behind the counter.
and they will take care of it
They'll
for you.
take care of it, but they'll collect them year-round, much like the used to be on the semi or twice-annual take-back day. You could only bring them that day. Now they will take them every day they're open. Ione PD, you don't even have to see anybody. Theirs is kind of in the foyer of their little department. You just go in, just like you're mailing them out letters, put it in the box, close it up, and good to go.
Great. Well, guys, thanks for coming by today
Thank
and
you.
visiting with us. Have we touched everything that you wanted to talk about? Is there anything that you want to add to this?
There are locations outside the county as well. If you want to find those, go to the don'trushtoFlush.org website, and you can find them all over California at this point. And again, we're hoping to get that one more geographic, located bin here in Amador County.
All right.